WHPT, Sarasota, Tampa, St. Pete. And now on 97.1 WSUN HD2, Holiday, Tampa, St. Pete. Now back to the Ian Beckles Show. Brought to you by Alex Sinek, Cooperative Real Estate.
All right, welcome back. Ian Beckles Show, Dignitary Radio. Hanging out at the Blind Tiger in Seminole Heights. Got a little party going on here.
Pack this place,
Packed
bro.
it up a little bit. That's good.
That's how you always do that.
Yeah, we try to do it that way. We have another hour of the show. If you're in the area, drop by, put your name in the hopper to get a chance to win this
magical
$175 piece of machinery. That, once like I said, it's magic, or it can be magic if you have something magical to put in it.
That butter looks magical.
That butter looks like it's magic.
He's a good marketer.
Yeah, you can put it in some rice or anything. Put some rosemary. That's all they're talking about is rosemary. No doubt.
Yeah.
Anyways, back in my other life when I was at the other radio station, I was exposed to this young man. You were there. I was exposed to this young man. Really as an endorsement.
Sure.
But what it turned out to be was probably the best thing I've ever done for my body. And once again, this is not an endorsement. I'm just telling you, and I've kept on saying this, that stem cell therapy is the future, and it's the present as well. But we have Dr. Dennis Locks here from Clearwater. How are you today, sir?
I am doing great. I'm enlightened now that I know about magical butter.
Magical butter, yeah.
So,
we're talking about therapeutic stuff today. It's beautiful. Now, stem cell therapy, I was with you 2 years ago. Mm-hmm. My knees were killing me. You did my lower back as well. And I said from that point on, my knees have not bothered me at all. Now, I'm going to go right to, where has stem cell therapy been? I know it's been around a long time, but why is it really coming to the forefront now more than it has in the past?
Well, when I first started about 8 years ago, it was kind of like slow word of mouth, and there's just a lot more people doing it now, so there's a lot more exposure. I was the only person on the west coast of Florida at the time, and now there's quite a few who are starting to do it now, and so I think it's becoming just more out there, and people are hearing more and more. I've had 3 news programs that I've done on different people from around the country, and so that helps.
Yeah, I saw something you did on Channel 8, I think. I don't know if it was Gail Guayardo, but it seems to be getting out there. But you were one of the pioneers. I mean, it hasn't been around much more than 8 years, has it?
There's been a few guys doing it a little bit longer, but when I started, there was about 10 in the country. So
in the whole country?
That were really doing it, that had names that knew what they were doing. And so I got it in pretty early, and then I got associated with these guys, and so I was on the lecture circuit, and I just got very, how shall I say, passionate about the research, and I learned my stuff.
Now, it used to be in the past, and I'm going to give you a great example. Dwayne Wade, okay?
Sure.
We all know of Dwayne Wade, basketball player. There was a time where his skills were diminishing, and that was 5 years ago.
Right.
And I believe he was exposed to stem cell therapy, and now Dwayne Wade is running around like he's a young kid. I mean, what percentage of basketball players and these athletes do you think are now indulging or getting stem cell therapy?
Well, I can't really say. I can usually pick somebody who recovers too fast.
Yeah, no doubt. Yeah.
But
is that part of surgeries now? Are people doing that right afterwards?
James Andrews has got his own stem cell department now.
Well, yeah, he does. Yeah, he does. And he used to talk to James Andrews back in the day. And James Andrews, if you don't know who that is,
the name.
That's the #1 orthopedic doctor
in
the world.
For sports,
in the world.
Yeah.
That's the only guy.
Right. Yeah.
Okay, so when he wanted knowledge of what was going on in stem cell therapy, he was calling Dr. Locks. Now he has his own little wing of stem cell.
I'm kind of shut out from his patients.
Yeah,
now.
well, he's going to make the money himself. It was only a matter of time.
Yeah.
But I've seen what stem cell therapy can do for athletes, and I'm upset that I didn't know anything about this way back when, because I'd have shot up every part of my body. Straight up though. I mean, my knees felt like they're at like 30%, and then afterwards it felt like they were 90%.
Do you think it would lengthen your career?
No doubt about that.
Yeah.
No doubt. I mean, once again, I don't know a part of my body that I wouldn't have shot up.
So why aren't more athletes doing it then?
You don't. I'm not saying they are.
Are they now?
They are.
So, Doc, I just had meniscus reconstruction about 6 or 7 months ago. Obviously, I don't I don't feel like my leg is the same. I can't do squats. I can't do the things that I used to do. Like just getting down into crunch position hurts. How would somebody like myself now benefit having, I had a great surgeon with Dr. Gutentag and he got me back to where I needed to be. But at this point, half of a year since surgery, how would that procedure help me?
Well, in understanding the science, the surgeons don't tell you, but trauma accelerates arthritis, and
yes.
Surgery is a form of trauma. So usually people have meniscal surgery due to trauma, and so you just had a double trauma, so you're going to get early arthritis. So
which is not good. I don't like hearing that.
Yeah. Well, no,
but it's true though. No, I agree.
Yeah, but it happened to me. I did my knees 4.5 years ago because I was a downhill racer, and that's took my knee out.
Yep.
So once you understand the science, people are now starting to be a little more preventative. I spoke in Aspen last year. I put a stem cell sports medicine seminar on, and I got Rafael Nadal's doctor to come, the one who actually did a stem cell.
Sure.
And he was reluctant to talk about it at first, and he would say he did PRP, but he finally came out and admitted he did it when I think it was 2012, he took about 7 months off. That's stem cell time. That isn't PRP time. So I asked him, I go, why did Federer at age 35 get his knee cut on? Because he was always so graceful, and
right.
He didn't have a good answer for me, because I thought that was a risky move on Federer's behalf
to do the surgery
at 35
right.
instead of doing stem cells.
So, once again, this is not something that is a football thing or a basketball thing or a tennis thing.
Life thing.
We're talking about a life thing. I bet the percentage of athletes who get is very low, considering what is your average patient? Is it the elderly people? Is it active 45-year-old? What is your average patient, you think?
A little bit of both. I have a lot of, the mid-age 40, 50-year-olds that are still very physically active, and then I have a lot of people who are getting older and they don't want joint replacement surgery.
Sure.
And a lot of them you would have rather had them 10, 15 years ago, but you only get what comes in your door, and sometimes it's not the best that
once
candidate.
you have joint replacement surgery, I believe they last like 7 years or something like that, and you got to replace it. Is that are you just delaying the inevitable? Are you still going to need a joint replacement down the road?
In some people, probably, but in my particular case, I'll explain it like this. My cartilage was getting pretty narrow, so it was getting close to the bones, because I was already arthritic, but I grew new cartilage, so now the space is here, and I'm getting close to 5 years. So at 5 years, I'll re-x-ray. If it ever goes down, I'll repeat it.
Really?
Then you won't get a knee replacement.
It's actually repairing it. See, now my neck, I went to Florida Wellness, and I'm having them give me some different things with my neck, and they x-rayed my neck, and my neck was pretty much perfectly straight, which is bad that I heard.
Right.
I'm like, it's great, it's straight. They're like, no, you're supposed to have a bend in your neck.
Right.
So, I got degenerative discs and stuff like that in my neck. Is that something that could be helped with stem cell therapy?
Spines are a lot harder. You got 7 vertebrae in your neck, 3 joints at every level, a disc and 2 facets, so there's actually 21 joints. And then you got your middle back, your lower back, and so what we can do with a spine is a little more limited, because a spine is like a Swiss watch. There's just so many moving parts.
Sure.
And it's not like a hinge knee where you got a left one and a right one. So it's just a little more complicated. So there are some things that we can help, and there's some things that we can't, just because there's so many parts.
Sure. Now, what is the most or the part of the body that you are shooting up the most? I would guess knees. Knees is a big part, you think?
Knees, and then I'd say hip and shoulder.
Okay. Those are other things that those surgeries, like I've had a torn, rotator cuff, and you're going to have a surgery eventually, because you can't just shoot something up and make it strong. You know what I mean? Those are all very serious surgeries. Once again, hip replacement surgery, you want to do what you can to not have a hip replacement
Absolutely.
surgery. You know what I'm saying?
Yeah.
Stuff like a hip replacement surgery, what type of recovery is that?
Ask Brian Callahan.
Yeah. I have 2 little things that I tell patients: try to stay out of hospital and stay out of nursing homes. Just good advice.
Those are two good things. Absolutely.
Yeah. Well, but the problem now, is that it isn't just that there's a 7 to 9% complication rate with joint replacement, so it isn't risk-free. And one of the big ones was infection. But, now we have the superbug that has made it to the hospitals that is resistant to all antibiotics. So you get that, and it's not like MRSA. This is bad.
Yeah, you don't want to hear anything like MRSA. Now, in layman's terms, okay, because you're going to talk over my head because, I skipped a lot of class back in the day. You know but in layman terms, I was trying to explain what stem cell therapy does. In layman terms, explain to people what, I know you're extracting the fat out of your, fat cells. From there, explain what exactly, once again, so people can understand what stem cell therapy does after that.
Well, there are really two big reservoirs in a human adult where there's stem cells, and they're in your bone marrow or below your fat. They're not in your fat, they're around it. Mm-hmm. And the reason they're there is in the bone marrow, if the blood cell dies, it needs to replace it, and the only way it can replace it is if a stem cell generates a new cell, and that's one thing that a stem cell can do. Humans have a tremendous capacity to expand outward with their girth, so in order to make a new fat cell, it requires a stem cell to make that. So it's the environment that dictates what the stem cell does, and so it can be a reparative cell if you take it from an area that is doing really not much and put it in, say, a knee or another joint that's problematic. Then the stem cell becomes a reparative cell. It stops signals that are breaking the joint down, and then it can actually convert into a new cell, such as a cartilage cell.
But why doesn't your body take it from that area that it currently is storing it? Your body's not connecting the dots, so to speak, to know that this area needs regenerative cells. It doesn't know. There's like a disconnect between your own body to know that this area needs help.
Well, yes. There are two problems. One, joints are avascular. There's no good blood supply, so they couldn't get there anyway. But we are meant to break down. And in the animal kingdom, if you become lame, you get eaten.
Right.
So we're not supposed to last forever. We are just now using advanced science to sort of circumvent some of the aging process.
Gotcha. That's interesting, man. That's amazing stuff. It absolutely is amazing.
It's a great question.
It's amazing.
My fat from my love handles, they don't know nothing about my knees.
Right.
It's a long way to go.
Right.
You know what I'm saying?
But they're both part of your DNA, which is crazy to me.
Yeah.
That they
I'd like to have less DNA over here.
you and us both, man.
But you actually have had some people come to you with ailments, and you have to be, I guess you have to have some physical capacity, or if somebody's really, really out of shape, would you do them, or do you make them sometimes lose weight to go through it?
Well, I've had some very difficult cases, and there are some that you just have to look at and view as, well, what choice do they have? If you have a 5'2", 350-pound woman, no orthopedic surgeon is going to operate on her knee because of operative risk. Yeah, no, right. So I've had to do that, but I generally have a long talk with them, and they promise me that they're going to modify their lifestyle. And I've had a couple that one lady was 358 and she dropped down to 150.
Oh wow!
Really?
And she improved.
Now, how much do you think was because of the stem cell therapy? Because if your knees are shot and you can't move, you can't lose 200 pounds.
No. That's true. But a lot of times the people who commit and come see me, they know that
this is it.
And so it's a big motivating factor. And she was in her mid-40s, so getting knee replacement or even attempting that at her age, and then she had 2 teenage children, so she wanted to see them live, and a lot of things that motivate people. But I've had equally as many 300-plus pounders that gain weight at the end of 6 months, and
really?
That's a bad sign.
That is a bad sign, no doubt. Now, you're practicing right here in Clearwater. You're also in California, right?
Beverly Hills, yes.
So, I mean, is it just because that's business?
Great address.
That's what I'm saying.
Great address.
People got loot.
90210.
Yeah.
People got loot there in Beverly Hills. Now, I have to say, this is not something that's covered from insurance, correct?
That's correct.
Okay. And I mean, that's a tough thing. It's not a cheap thing. But I said this to people that, listen, what's the
life
number to change your life.
Right.
You know what I'm saying?
Yeah.
Now, I don't know how many surgeries you've done. I mean, you've probably done thousands of surgeries. What do you think the success rate of the surgery is? It can't be 100%.
No, but I just explained. Sometimes I get some very, very difficult cases, so you can't compare them to the average person.
Okay.
So if you were to take the best cases, younger, motivated, athletic people, they do great.
Sure.
You know, teenagers. Every teenager I've done has done well, and I think 3 out of 4 have gotten college scholarships.
Okay.
Because it was all athletic injuries.
So once you shoot that area and the cells start regenerating, is that a continual process? Is it? How long does that last? How long is it constantly going after?
Do you have to do it again after that
is
first?
there other treatments, or is it everybody different?
Well, the majority of people need just one. I mean, 4.5 years out from my knees, and I'm doing perfect. There is a 14-year-old soccer player. They were going to fuse her ankle because she had avascular necrosis, the same thing but Bo Jackson had, a dead bone in her ankle. So, or they didn't know what to do with her, so they were going to fuse her. Well, you fuse a 14-year-old, she's never going to play soccer,
right?
And she's not going to wear high heels,
right?
You know, so if you start looking at her as a human being, maybe that's important. So we did her and then followed her up over time, and she went back to playing soccer, leading scorer on her team, and this made the news in Orlando. Well, I just saw her back. Now she's 17, and she's got a college scholarship for Maine.
So she's obviously doing just fine.
That's wonderful.
And her last MRI showed no evidence of dead bone at all.
That's amazing.
So it actually, so once again, it makes you feel better, obviously, because I'm attest to that.
That's amazing.
But it's literally healing.
Yeah.
Which is, I mean, there's nothing else does that.
No, nothing else will make a dead bone become alive again.
Regenerative. That's what that.
Correct. And I've seen that in some of the younger patients. You can get, you know, really phenomenal results. But if they're, 60 and they got a dead bone, generally you're not going to get it to come back. But you'll get. You try to prevent it from becoming a more arthritic joint.
Yeah, you get the benefits of the healing.
Right.
And once again, I've had people say, well, what is? I don't know what it is.
Right.
All I know is it makes my knees
feel great.
Pretty damn good.
It's amazing.
Now, so give us some, we talked about knees. I know neck is a very sensitive place. What are some of the other regions? I mean, lower back, I'm sure.
Yes.
We'll get a lot. If somebody has a bad lower back and they're walking a little slouched over and they get a little stem cell therapy, what can they expect? What have you seen as far as something like very drastic as far as the way somebody heals up?
Well, I've had some backs that have done fabulous and their functional levels improved quite well. I've done a ballerina's toe, and if a ballerina and can't dance, she's hurt because they usually have mangled toes. So she did well, and she went off dancing. So I've had some interesting cases over the years. So.
No doubt. Well, eight years, 2 different states. How many stem cell therapy surgeries you think you've done throughout the years? How many think you've done?
I don't really know because I don't keep statistics.
Is it
like
in
that.
the hundreds or is it in the thousands?
Thousands, probably.
It's in the thousands. Yeah. So as far as, the other stem cell therapy doctors in the nation, where do you think that would rank as far as doctors in the nation?
I'm up there.
You're up there pretty high.
There are some guys that will give you statistics like I get 85% of my people better. But I have such a diverse patient practice that you can't lump them all together.
Sure,
they're so different. I had one guy, heaviest guy I ever did was 415.
Okay.
He's 330 now. So he's on his road.
Yes.
He's on the road to success.
There's a big difference between 415 and 330. I've been 330. I haven't been 415 yet.
No.
But I'm working on it.
Yeah, but most people wouldn't want to include that gentleman in their statistics.
Correct.
But there's times where I'll take on tough cases because they're human beings.
Sure.
No doubt.
That's awesome.
Well, listen, stem cell therapy changed my life, and I know Greg's going to look into it.
I'm going to look into it, man.
Dr. Locks is the best in the area. If people want to get in touch with you, drlocks.com. That's drlox.com. And he's part of the family, bro. He's part of the family, and we want everybody out there to feel good about themselves.
Sure.
Because I remember when I was on the radio show and when I was doing commercials for you, every day somebody approached me and asked me about stem cell therapy. That's why we got to get people hip to what's going on out there. You do a wonderful job.
Great job, Dr. Locks.
You got
Awesome.
me running around and bending around like I'm a youngster. So if you want to feel good as well, stem cell therapy, I mean, it comes highly, I'm telling you. But
You're a believer, man.
I'm a believer, no
You've
doubt
had it.
about that. DrLocks.com, that's DrLox.com. We're going to come back on the other end. We have the lovely Mary Delgado. We've talked a little pop culture, all kind of stuff like that. This is the Ian Beckles Show, Dignitary Radio. We're at the Blind Tiger. Sipping on lots of coffee. You know what I mean?
You got the extra dignitary glass, too, bro.
Full of ice, no doubt about it. We'll be back on the other end, 102.5 The Bone, Real Raw Radio.
The Ian Beckles Show on 102.5 The Bone.